So, as you know, this is the Orcuda. She had her first specialist appointment today, which we've been waiting for it feels like forever, 6 months almost. And so I thought we were just going in for a consultation and we'd go over the CT scan maybe and talk about some plans and figure out schedules and what kind of surgery she's going to need and all that stuff. But then we were talking and Dr. Rochette was saying that they were going to keep her and do some really good dental x-rays and stuff. And then she just sort of offhand was like, and you know, if we think we can fix it today, do you want us to go ahead and do it? And I was like, oh, totally not expecting it. And then, but I was like, yeah, of course, that would be amazing. So, sorry, I don't know how to turn up the sound for this. I'll try to talk louder. Or you can go to YouTube and they're CCing over there on the YouTube chat. So anyway, so they were going to keep her for a while, so I left her there and was, you know, sort of anxiously awaiting any sort of updates because she mostly was just going to, you know, do exam and x-rays and that sort of thing. And so I got home probably, so our appointment was at 9:30, but I had to leave at like 8 because of the traffic and everything. And then, so it was probably around, like, I got home around probably 10:30 or 10:45 maybe. And then was just like pacing around waiting to hear. And then around 1, I called them for an update and they said that she was just going into surgery. And I was like, oh, are they doing surgery? And they were like, oh, well, I don't know, that, you know, they're going to do sedation and take a look first. And so, so then I continued pacing for like the rest of for like what seemed like forever. But I was trying not to bother them because I knew they were busy. And are you fascinated by this? And so finally it was probably around 4:45. Don't do that. I got a phone call from one of the specialists, because there was a whole team of them, and he told me that she was done and waking up, and I was like, what do you mean, done? And he was like, we repaired her palate, and then he went and told me all about it. And so I'm still kind of in shock, and I haven't exactly like processed this, but it's her palate is fixed as of this moment. It's we have to make it at least 10 days without it opening back up, and the bigger they are, the more likely they are to sort of open up. So that's why she's grounded, and I'm going to keep her in my room and like take anything sharp out of here, all the toys. Sorry, she's gonna have to play with, like, I don't know, I have to keep her quiet and make sure she's not like pawing in her mouth and stuff like that. So it's gonna be a lot of intensive monitoring for her, but if we can get through the next 10 days, then we're gonna be in really good shape. So that's like the biggest surprise twist of the century. It was a very long surgery, obviously, and what's really cool is that they were able to use a bone plate that was donated from a dog to stabilize her palate because the hole was so big. They basically put it like at the back of her hard palate and the front of her soft palate, and then overlapped all of the tissue so that there's something there that's holding it together, and will hopefully just add some stability and give it a nice base to grow from. So ask your vets about organ donation, and also for humans too, being a blood donor, organ donor, anything like that. You make stuff like this possible. So she's definitely feeling very high right now, which is good. So there's like so many amazing things about this today, but no rejection medication. They have a way to basically strip everything away except for the bone, so we don't have to worry about anything like that. And it's they take them, you have an option when your pet passes away to donate a little part of their bone. They only take a little bit of it, and then it goes into a bone bank, which is in Washington. So yeah, so it's not something they do to live dogs, but once if you've lost your pet, it's an option that makes something like this possible. So which I didn't even know of. So I think it's really good to at least be aware of these options. We learned about pets that are blood donors last year. Now we know more. So that's super cool. I can't wrap my head around it either. I've been so worried about this for 6 months. Like every day I've been worried about this, and like what's going to happen when we get to this point, and is she going to survive the surgery, and all that stuff. Will it work? Is it even possible to do surgery? All those questions are now answered. So she's a little bit bionic now. Cat dog. And I haven't seen, she said they took pictures. I actually haven't checked my email. It's possible that they have, nope, they did, they were kind enough to take some photos and some videos, and they made sure that they took a video of her first eating canned food on her own, because they had seen her video of her eating her first kibble. So they were like, well, now you can do first kibble, first canned food. So we're doing another abrupt food switch from only kibble to only soft canned food. And apparently she ate a whole bunch on her own already. And so that's super exciting, because eating has always been a struggle for her, for both of us, and trying to get enough calories into her has been incredibly difficult and time consuming, and now that hopefully there will not be as much discomfort associated with eating, maybe we can fatten her up a little bit. it's going to be tough over the next couple of days because you imagine how it feels to have all that stuff in your mouth. And so, oh no, you can't leave. You have to stay here. You have to stay here and rest. Unless you have to pee, then you can go. You can go if you have to pee. Oh, you're so beautiful. You look so beautiful without a cleft palate. Don't you look so beautiful? Oh, lost network connection. I don't know how that happens. There we go. I guess I'll wait till, I was trying to wait till the connection came back. So where was I? Oh, and do you know what else is so exciting? Is that they didn't have to pull any teeth. Because I had been expecting from the beginning that we had talked about having to pull like one side of teeth in order to have enough tissue available to cover the hole, and they didn't end up having to do that, so that is awesome. So I have to keep a close watch on her tonight for swelling and pawing. It's okay if she paws outside of her mouth, but if she's like trying to paw inside her mouth, or if she's trying to chew on things, I will have to intervene and disallow that. So this is, she has a sparkle bandage on her leg, which I can probably take off now. I definitely can take off now. Should we unwrap this? You're not gonna bleed all over me, are you? I have Kleenex over there. I don't think so. The last 2 times I've taken her bandage off, she's had some bleeding, but I think, oh, good job. Good job, you're so tough. No more sparkle wrap. Although it was very beautiful. So every now and then you'll see her doing that because it feels funny. So that's okay. But it's better. We like when she's just quiet. We like it the best when she's just hanging out. So I'm going to try to keep her calm. I know now I get to cancel all my plans for the next 10 days. Because this is where I will be. Oh, I know it feels funny. It's all right though. Do you know it's gonna feel so good in like 10, probably like 4 days. You'll be used to it in 2 days, 1 day maybe even, 2 days, and then it's gonna feel so good. So what else? So both of her eardrums are damaged, just from the pressure and the inflammation. There were so many things that I didn't ask because I was like completely in shock that this has happened. But they're gonna call me tomorrow, and then we have a follow-up appointment next week. So she doesn't have really any turbinates, which are the little bones that filter out the impurities and viruses and germs and stuff. So she'll probably be doing snot rockets for her whole life, but that's okay. They didn't see any ear polyps, so they weren't sure if maybe there was fluid and mucus and stuff in there that was showing up on the CT scan, or if there was something that they would need to go in a different way to look at. And since she was in surgery for like 3 hours, that was one less thing that really needed to happen right then. So they looked and they didn't see anything. So we'll just see how she does with her ears if they seem uncomfortable at some point. But that part will be easy compared to this part. And hopefully her eardrums will heal, but I don't know. So she's not perfectly normal in the traditional sense structurally, so she'll still have some issues, I'm sure, but she will be able to eat hopefully without pain and without getting things up into her nose all the time. And so that means I'm hoping far fewer infections, and so we'll just keep getting things sorted out as we figure out the new normal. But the next 10 days are going to be critical, and it is fairly common for holes to appear, especially in such a big repair. But if that happens, then we just let this heal and then go back in and fix it. And it'll be easier if they have to fix it, like, you know, if it's this long, the repair is you know, if it's like this long and like, you know, this much of it opens up, that's a much easier repair than what they did today. So I still can't believe that they did it and it's done. And she made it and everything looks good at this point. So it's been a big day, but with a very good ending. Dr. Rochette said that I can offer her water in a bowl. She can eat canned food like normally, so because everything's closed up at this point. The bubble is her carrier, little window on her carrier. Yeah, so I was expecting that we would have another couple of months of surgeries and recoveries ahead of us, and so it's a huge relief to have this done and have it be successful. I can't believe it. So I'm probably going to be in shock for like the next couple of days that they did it. Look at her, she's so high. You need to just curl up and go to sleep. Here's Wedgeopotamus and your artisanal blue carrot. Puff Puffs is around here somewhere. So I'm going to be spending most of my time with her, just making sure she's, you know, breathing okay and good and everything. So yeah, it is kind of nice that like I would have definitely been worried leading up to surgery, and worried, like, I mean, I would have been super worried. So to have it done, and I was worried today, but I didn't even know that it was happening really. So it's kind of great. It's kind of a great way to do it, right? Yeah, I fasted her for kittens. We don't really fast as long, but I did fast her for a couple of hours, and just in case they had to sedate her for whatever. I know we would have all been worrying, pacing together. She's definitely on pain meds, and will be for several days. We are all good advocates of pain meds for sure, so. Yeah, I thought it was just a consultation, but they ended up being able to do the surgery today. She has all of her teeth. And you can see she gets a little mouthy with it sometimes, but she's actually doing incredibly well. Puff Puff will be able to snuggle with her. I'll have to keep him entertained out in the big room. So, pretty good news, right? Thank you guys. Oh, like there's a little blood coming out of your nose. I think that's normal. But we'll wipe it because it looks a little bit, it looks alarming. Yep. Now we're gonna have bloody snot rockets for the next few days. Is that what's gonna happen? Hopefully not too much. They were pretty impressed that she survived at all, I guess. Pretty impressed. They said she's used up at least 4 of her 9 lives, so. But I'll take it. That means we have 5 left. So that's good. I will post this video so that you guys can see what you missed. So I have to read, I haven't actually read the instructions yet. Bright and alert during her awake physical exam. No evidence of lung changes secondary to possible aspiration. That's the big one, that they were most kittens with clefts even close to her size die of aspiration pneumonia. A small amount of blood-tinged saliva or snot rockets is expected. Noisy breathing, occasion. This is a result of the. Also sneeze, which may or may not be productive. Oh, your sneezes are productive, aren't they? You have some productive sneezes. Yes, you do. One complication that can occur after surgical repair is the premature opening of the sutures. Signs of this include decrease in appetite, drooling, blood-tinged saliva, odor, increased nasal discharge, coughing. And as I was saying, repair of soft and hard palate defects can be complicated. It's not uncommon for patients to need more than one surgery until final repair is achieved. So so we're ready for it. We hope it doesn't happen, but we're ready for it. Ooh, buprenorphine 0.07. That's nice. That's fun. So she's got an antibiotic injection so that I don't have to wait, a good girl, so I don't have to give her doxycycline for the next 14 days. Hopefully. We're hoping we can get away with that. Aura should not be allowed to play with any toys. You're so cute. When I walked in, the doctor was sitting in the reception area in one of the chairs and cuddling Aura, just like, you know how she loves to curl up like on my chest. That's what she was doing. It was very adorable. It was so cute. You did so well. They all loved her. There's a little eye crust. I will take care of it for you. Good job. So 10 days of monitoring, and then our appointment, our follow-up appointment is next week, is the same day Celia is having her surgery. So that will be another big day. That's on Thursday. Another big day for all of us. For Celia will be a huge day for her. Oh, what a good girl. Look at how beautiful you are. She doesn't look like she had major surgery today. Except for the dopey eyes. You're beautiful. Are you happy to be alive? You're gonna get to eat food like a normal cat? Are you excited? She's gone cross-eyed. Remember when you used to sleep with your eyes open? A little creepy. So anyway, good news. Very good news. Very exciting. Oh, I know. Stop playing with it. So we are going to be, so everyone's going to be surprised until they hear the news. I'm surprised. I'm still in shock. It hasn't quite hit me yet. I have not tried to look inside her mouth or anything like that. So, I might move the VIP cam in here. Yeah, you can lick your paw, but you can't paw your mouth. Are you excited to eat canned food? I hope you like it. She did like the canned food she got at the vet, so that's good. So, unexpected surprise, very good surprise. The team at West Coast Veterinary Dental Services was awesome. They're the same ones that did Calvin's teeth and Quinn Bunny's teeth and probably a few others, and they always take such good care of them. So I think once the shock has worn off, I will probably have more things to report, but little cat dog. Are you a little cat dog? That's so cute. Oh, she's staring at the wall. Good. All right, so I'm gonna turn this one off. Thank you for tuning in. Thank you to everyone who has donated. We have some seriously expensive cats in our care right now, but they're obviously all worth it. But we really appreciate your support because that's how we're able to have miracles like this happen. And also big thanks to our VIP viewers because you guys give us a baseline that we can budget from, which really helps us to know that we can take in more cats and continue doing what we're doing. So we're very grateful to all of you. Right? Oh, they're so beautiful. Oh, snarfly. So much snarfle. No saliva though. Yep. It's gonna be interesting trying to sleep because she's a little snarfly. She likes to sleep right here on my face like a starfish, but she can't always get comfortable, so she like flops around and puts her butt in my face, and now there's gonna be bloody snot rockets everywhere, and I'll be like waking up every 10 minutes to make sure she's fine. But that's okay, because we did that for the first like 6 weeks anyway, remember? We were up all night, every night, partying with your tube. All right. So, Nico Beautiful. All right, so anyway, thank you for tuning in, and I'm gonna sign off. I'm starving. She's probably starving. I know the teens are starving. Hyatt needs some eye meds. Mason needs his dinner. So, got some cat stuff to do, but I might try to set up a camera in here so that we can keep an eye on the situation as soon as I leave the room. Are you gonna start running around, jumping off furniture? Probably. I have her on a heating pad, which is her favorite thing, to be on a heating pad, so she looks pretty comfy right now. So anyway, all right, now for real, I'm going to sign off with that. There you go. Oh, so cute. All right, thanks guys.